Hi, everyone. Thank you so much for joining us today in going through the staff training for using ParentGauge. There are a few updates in case you've been through a previous session, so I'll point those out. But again, thank you so much, and let's jump right in. My name is Kate Klingensmith. I'm the product manager of ParentGauge. What that means is I work directly with programs and centers to understand how ParentGauge is best meeting their needs. So is there anything we could be doing differently to make your job easier? How are you going to get the most value out of this? I take that feedback and I turn it around to our software development team in shaping the roadmap of how we're going to be continuously improving ParentGauge for all of you. In terms of what we'll cover today, I want to focus on your role in terms of actually conducting interviews with families using ParentGauge. I will give you a high-level overview of what ParentGauge is, and then we'll walk through the system. We will look through the navigation, and then we'll focus mostly on actually conducting an interview and then how to read your reports. Some of you already know all of this, so I'll try to keep it brief. Where did ParentGauge come from? The Office of Head Start released the Parent Family Community Engagement Framework around 2015, and NHSA realized that there was no scientifically validated instrument for actually measuring engagement. So National Head Start Association worked with the University of Chicago's research team and developed a set of questions that we can ask families to understand how they are engaging with their children and then how they are engaging with the programs. ParentGauge is a web-based tool that you can log into using a computer or a laptop or a tablet, even your mobile phone. This is something that you'll log into, not your families. This is really intended to act as an instrument to facilitate a conversation. It's a formative assessment, which means we want to have this conversation with our families twice a year, maybe even 3 times a year. We highly recommend doing this interview in the middle of the year. That may be December, it may be February, and then again at the end of the year, which may be May or June. There is an optional beginning of the year interview. You could baseline your families and sort of see how they're doing, where they are when they get started with you. And that set of questions is a little bit shorter because we're going to focus only on the parent engagement with the child, not the engagement with the program, since they haven't had much experience with that just yet. So you can set this up to, talk to your families 1, 2, or 3 times a year. The interview itself consists of 10 open-ended questions. These are sort of just conversation starters. We can listen to family stories and hear about their experiences. And then there are 35 or 45 closed-ended questions. These are all agreement statements. So how much would you agree with this? And it's essentially on a scale of 1 to 5. The entire conversation can take just about 20 to 30 minutes. And families really feel like we're hearing their stories. They're providing us with immediate feedback about what is going well and where they may need additional support. And then, of course, the data is aggregated across your sites and your program to understand the trends, to maybe even tweak programming. So in terms of it being a formative assessment, the idea is we talk to our families, we learn from them, we may make some, differences in what we're doing, we may add some additional resources and support for our families. And we go back later in the year and measure to see if the changes that we've made had an impact. So in terms of the system, there are a number of roles. You will have a program administrator sort of sitting at the top of your hierarchy, and they may then designate at each site, or what we call centers in the system, a center administrator. And then we've got our sort of staff roles. These are going to be people probably like you who will be actually conducting these interviews. You may be a family advocate, family service worker, a teacher, or a home visitor. And the only difference between these roles is that the administrators have the ability to sort of set up the system for you. They're the ones who will be creating the staff accounts and getting you access. And they have the ability to do a couple things with records such as a child or a guardian in the system or an interview where they can lock or delete these things. That's something you can't do. So I'll touch on this again later. If there is ever a point where you may have created 2 records for the same child or created 2 interviews for the same family and you need to delete something, you would contact your administrator and they could delete that for you. I'll be sending out the materials after this, so I just wanted to make sure it was comprehensive. You might want to go ahead and bookmark the website that you'll be logging into. It is parentgauge.nhsa.org. If you haven't already gotten an account, you should contact your program administrator. You can always reach out to me if you don't know who your administrator is, and they'll create your account. Now, the first thing is that you'll get an email from the system with a temporary password and instructions for logging in and changing your password, and then you're set. One really important point that I want to make right now on the login page, there is the ability to retrieve a password or create a new one. I know that many of you will only be logging into ParentGauge for this 1 month, and then there may be a couple months in between the next round of using the instrument. So if you forget your password, don't worry, you can just click on Forgot Password, and it'll send you a new email, again, prompting you to enter in a new password. So I'm going to jump right into the system here. Give me just a second. I'm going to keep my presentation open on the side here, just so I make sure not to miss anything. But what I really want to do is give you sort of the live tour of ParentGauge. So let's go ahead and log in. One thing I want to point out here is that we are using a demonstration site. So this is actually fake data. So all of these names and all of these data, all of the records, all of the interview responses, these are all made up. So that's something that we've designed ParentGauge for, is information security. We want to make sure that you're only really seeing names and data that you should have access to. So when your administrator creates your account, they'll be assigning you to one or possibly multiple centers. And you'll only really be able to see the rosters and the data from the centers that you have access to. So really quick tour of the navigation. I want to point out we call this the toolbar up here, and each of these are a tab. We're currently on the Home tab. We also have our guide. We have our reports, management, which I will be going through each of these rosters, is what I call them, with you. We have a click link to start a new interview. We have a site-wide search, and then we have our tech support. I'll go through each of these. Let's start with the guide. So this is here to support you. We've been told that ParentGauge is actually really easy to use, so hopefully you won't need this very much, but I want to point out a few what I consider to be sort of bonus resources here that we've generated based on feedback over the past 3 years of ParentGauge being live in the field. Now, this very top link here is Interviewing Skills for Excellence. This takes you to a YouTube video of an actual interview this is one of our research assistants at the University of Chicago, Gabe Velez. He's showing best practices, tips, and tricks for speaking with a guardian of a Head Start or early Head Start child. And he actually conducts a part of an interview in Spanish, and he conducts part of an interview in English with real live Head Start mothers. He stops every once in a while to tell you, here's what, if you might have noticed, I paused to let her think. I prompted her again after I asked this one question. And then one of my favorite tips that this brings to the table here is you might notice that he's sitting side by side with the guardian. Obviously, in the time of coronavirus, that's probably not very possible, but once we resume our home visits and we're able to actually meet with parents in person, this is a good idea to let them see what you're typing in to ParentGauge so that they feel comfortable that you're not grading them or something like that. Now, we're never going to slide the computer over and just have them enter in their answers, right? This is actually to facilitate a conversation and to engage this family, to help them know that we're here for them. We want to hear how things are going and learn what they might need. So that's just one of our resources here in the guide. Of course, we have our FAQs. Then printing interview questionnaires. This link takes you to links to actually print out PDFs of the interview templates themselves in English and in Spanish. So although this is web-based and it's exciting that you can just enter this digitally, we do recommend that you carry paper copies with you just in case a family's home doesn't have Wi-Fi or cell phone signal. And this form can be manually recorded, the responses, and then you can then go into the system later and enter them in fairly quickly. So these templates are just general templates, and you'll see here there is some logic about certain conditions. So if a child is aging out, they're going to be moving on from early Head Start to Head Start or from Head Start to kindergarten next year. We ask these extra questions, but if they're not, then you skip this section. So there's every single question you could possibly need to ask is printed out right here on this page. Now, another really great resource that we created based on feedback is this visual response scale. Now, what we've heard from interviewers is that sometimes families have trouble remembering the answer choices on those 35 to 45 closed-ended questions. The answer choices range from not at all to very much, but sometimes they lose track of which answers there are available. So what we did was create a visual response scale. We also recommend printing this out and allowing parents to see it in front of them. And if they just want to, especially for maybe English language learners or there's any kind of language barrier, it's very easy for them to see visually how they might want to respond to your questions, ranging again from not at all to very much. So that just about does it for the guide. Again, this just has a lot of other information about how to accomplish what you need to within the system. Now let's move on to our rosters. I'm going to start, not with interviews. I'm going to start with staff because it's very basic. I really don't know, if anybody ever uses this, but it's just allowing you to see who your colleagues are in the centers that you have access to. And, you'll have their email address and you'll see, who's actually doing this too if you need some sort of peer support. Now, let's look at the child roster. Gets in more to the meat of the system. So within each of these rosters, I want to point out a few features. First, on the left-hand side of the page, we've got our filters. So I could, if I just want to find one child, I could search by name. If I, for example, my program had decided that we were going to take only a 50% sample of all of our children that were enrolled, I might need to look up my sample from this spring. But that's an optional feature that your program will tell you whether or not you're working off of a sample of your full roster or whether you're working off of the full roster. I can look up just my interviews that may be incomplete, so maybe my not started beginning of the year interviews for next year, or maybe my not started interviews, from the middle of this year, or I could look at my completed interviews. I can look up just my children who are active. By default, this list is only our active children, but if I wanted to look at a historical record, I could go and look at my inactive children here. I can filter this down by the centers, or I could even just look at the kids who are in one teacher's classroom. Now, you may be wondering how this roster got here. There are two ways. Either one of your administrators uploaded a report straight from Child Plus, which would have automatically generated all of these child records, or these could be entered in manually, either by an administrator or they may delegate this to you. In order to create a record for a child, let's say that we had someone enroll in the middle of the year and we just quickly needed to create a record for them so we could speak with their family about them. These forms are very easy to use, take about 1 to 2 minutes to complete with very few required fields. So let's say that you were tasked with, I got a new kid and now I need to create a record for them in the system. First, I would need to select at which center they're enrolled. I don't right now have to associate them with the guardian. The guardian record may not even be in the system yet. I could do this if they were in the system, but I also don't need to because this association is made whenever I create a new interview that has the child and the guardian together. We now know who that child's guardian is. So we need the center, we need the child's first and last name, and then there are a lot of demographic data points that are optional. So we could, indicate whether they're male or female or something else. We could record their birth date if we have it. This is a good idea because if later you want to slice and dice your data by looking at the families, for example, of 0 to 2-year-olds versus your families of 4 to 5-year-olds, how are they doing? How are they feeling? You could do this based on the children's birth date when you're looking at your data. Same thing with all of these other data points. Now, the only other 2 required fields are going to be program type. So are they Head Start, Early Head Start, maybe Migrant Head Start? And then are they center-based or home-based? Now, I really want to emphasize something here. These last 4 questions are also optional, but these last 2 are extremely important because they actually have an impact on the question set that we are asking the parents. So is the child in the last year of the program? This is the aging out scenario. If we say yes, as you saw already in the template before, if we say this is true, we're going to ask 2 additional questions to the family. If we indicate that the child has a disability, this could be a physical disability or that they're on an IEP or something like that. If we say yes, there are 4 additional questions that we ask the family. So it's very simple to create a new child, very quick and easy. Another feature here that I want to point out is download results. If I click this button, I'm going to just generate an Excel spreadsheet into my downloads folder. And it'll be a very simple spreadsheet. If you like working off of these, maybe you want to print this out so you can physically put check marks by names or notes. You can automatically generate a spreadsheet from any one of these rosters in the system. Now, in terms of managing your rosters, let me just quickly show you the guardians. Same thing as the child. We've got a few filters over here on the left. And by the way, you can stack these filters. So I might say I only want to see my completed interviews from one of my centers. You can actually use as many of these as you want and click filter, and it'll narrow things down to exactly what you're looking for. The guardians are the same. I can create a guardian using a very simple form if they haven't been pre-populated by my Child Plus report. Very simple form here. You only need to indicate at which center their child or children are enrolled and their name, and that's actually it. But again, we have a lot of additional data points. If you have this information, you might want to include it because it allows you to slice and dice your data later in the year. If we want to look at, we've got our unemployed families. Are they responding differently and needing more help, for example, maybe than we've got our full-time employed families, right? So again, these are optional, but may help you understand what's going on with your specific families. Now, one thing I didn't point out at looking at these rosters, you can also click on any one of these names, and there's the ability to quote unquote edit these records. So you'll see here the details of this one individual here. You'll see who the children are that are associated. And of course, if there are any interviews that have been conducted with this guardian, they would be listed down here, and you could click on one and go straight into that interview. So that's about it for those types of rosters, but now let's jump into interviews. This is kind of the meat of Parent Gauge. So we have a little bit more extensive filters over here on the left. One thing of note is that not all of the filters are showing on the page. So you may see I'm scrolling down right now and I'm finding additional filters. So what you would want to do is hover your mouse over this and scroll down if you wanted to use some of these filters more towards the bottom. Now, in terms of interviews, I can filter these in so many ways. I can find my incomplete interviews from, I just happen to know our fake data in here. It comes from 2017-18. I could look for just interviews that are incomplete from Miller Group, and I could look for just the interviews that I'm doing or I have done. So you notice I just used multiple filters. Now I'm going to see what I get. So now I've just got, you notice my incomplete interviews for me, that I'm the demo user right now. And I can click on any one of these interviews and it'll take me straight to the interview form where I can then, if it's incomplete, I can actually complete the interview. So going back to the interview roster, similar to the children and guardians, we are able to download a spreadsheet of these interviews. It's going to be basic information. This will not contain any data that the interview has generated so far. This will just be a sort of a checklist, if you will. And then to create a new interview, it's really simple. I have two options. I can either do this by going to my roster, interviews that are under management and click create interview, or I have my quick link up at the top here to start a new interview. So in order to start an interview, you may create this form. You may sit down one day and create, if you're supporting 18 families, you may create all 18 interview forms at once, or you may do this in the 5 minutes before you're talking with the family. It's really quick and easy to do. So I'll first choose the center at which we'll be talking about it. One child, most likely, will pick the center at which they're enrolled. Now I'll need to assign the guardian with whom I'll be speaking. Let's just say I'll talk with Mr. Wallace about his child, Lisa Harris. And then I select the date which I'm going to be interviewing them. Again, that could be today, it could be next week. So you have two ways of doing this. You could click this down arrow and get a calendar, or you could type this straight in. So for example, I may be saying, nope, I'm going to do this interview in the next hour today. And is this an initial, like a beginning of the year, a mid-year, or end-of-year conversation? At this point in our lives, this would be an end-of-the-year conversation. The mode, am I going to be speaking with them in person or over the phone? Most likely these days I'll be talking to them over the phone. And then in which language will we be speaking? I'll just go ahead and say English. I submit this, and suddenly I've got a new interview form. Now, I'm going to actually go back to an interview that I already know of a child who has all of the conditions that give me all of the questions. Let me just make sure about this. Yeah, great. Okay, so starting from the top, you'll notice a print button. This is a little bit different from those templates that I showed you in the guide. This is going to be printing out this actual interview. So it'll be populated with all of the information, the date, the names of the people we're speaking with, and the child about whom we're speaking, and et cetera. And then as soon as you start to actually record answer responses from the questions, they'll also show up here. So sometimes programs are using this after the interview is completed, just to print this out and stick it in a file to have a paper copy. So that's one of our features. Now, we also have the ability to translate this entire conversation on the fly from English into Spanish, French, and Arabic. I'll show you this again as I'm going through the interview. This ability to flip between languages is available on every single page. So let's say that maybe you're a native English speaker, but you're talking to a family in Spanish, but you need to sort of flip back and forth so you know exactly what the question is asking. You can flip back and forth on the fly. We have the ability to mark the interview as complete, and then we can always mark it as incomplete again. Again, this is just for workload management. Now, this button, Edit Interview, it doesn't mean editing the answer responses. Unless this interview is locked, you can always come back in and fill in more information. I'm going to go back into English real quick. But Edit Interview is actually only going to take you into the interview form. So for example, it's like, oh, you know what, I actually was unable to speak with this family today, so I'm going to move it to tomorrow. This is where you edit the details of the interview. I am not using a good browser for recording, but you do also have the ability to record audio. Now, this is a great feature in case you don't want to stop and take notes as you're talking. If you want to facilitate the flow of the conversation, especially with those 10 open-ended questions, you can record any audio as long as the family has given you permission. And that audio file will now be attached to this interview. You also, in the case that you're using a browser like mine, and maybe I have a phone that has a voice recording app, I can email that recording to myself and upload it here, and it would now be attached to the interview. You can also record multiple times. So if you just hit record and then you stop it, and you know that that was, question number 1, and then you hit, once you're at the end of section 2 and you hit record, and you can actually attach multiple audio files to this one interview. So getting started with the interview, one thing that we did that we provide as sort of ease of use for you all is a lot of natural language prompts. So, for example, if we're sitting down with a family, we just want to make sure to sort of start them off with, thank you for agreeing to participate, and sort of setting the tone and the understanding of what we'll be talking about. So I would sit down with a mom or a dad or an aunt or uncle and just say, thank you for agreeing to participate. I'm really interested in learning about your and your child's experiences with our center. I'll be asking you questions about the center, your relationship with your child, your role in your child's education, your family's health and well-being, and your experiences with the staff here. I'll ask you how you currently feel about your readiness and skills as a parent, and I'll also ask you about how the program may have affected you. We want you to reflect on your experience, since we have the enrollment date of the child maybe, so this fills in the month in which they started. Now, we kick off this conversation with a very open-ended question. So let's get started. Tell me about your experiences so far with, fill in the blank Head Start or Early Head Start. Tell me how the program has helped you and your family. Now, that's kind of a broad question, and just since we're getting started, they may not have a whole lot to say, so we've also included a secondary prompt here. For example, tell me about how the staff got to know you and your family. Now, these sections, these open-ended questions, are just blank text fields that you can type notes into. We highly recommend you don't try to record everything verbatim, but instead what we want to focus on sort of, it was great. We had a meet and greet night. I had a welcome packet, felt very comfortable right away. Or, I don't think the staff really did anything to reach out. So what you'll hear are stories about what's going well, and you'll hear stories about where we definitely have room for improvement. So we're getting immediate feedback on, sometimes you'll hear things that you can act on right away. Now, for each of these sections, you'll see we have some navigation up here. But what I want to do is click next each time, because this next button actually acts as a save button. So let's say that you're sitting on your tablet and you're recording answers and then the Wi-Fi drops or something like that. Anything that you have done before you clicked next has been saved in the system, just in case you think suddenly the whole interview is gone. So that was an open-ended question. Now we're going to get into our what we call closed-ended questions. So again, these are agreement statements on a scale of essentially 1 to 5. How we explain this to our families is, each of these sections has a theme, and these actually align with the PFCE framework. But so, for example, we'll start with building our relationships. I'll say to the family, okay, the next questions are about your relationship with your child and how our center may have contributed to it. How much do you agree with the following statements? The options are not at all, not very much, somewhat, mostly, or very much. Now, throughout the course of each of these sections, you may need to repeat those answer choices. And again, if you print out that visual response skill, that really facilitates, so you don't have to keep repeating the answer choices every time. But let's just walk through a few of these. One thing that you'll notice is that you have 2 and 2A, 3 and 3A. We call these coupleted questions. You may start to think, and the family may comment, I think you just asked me the same question twice. But what's really important about Parent Gauge is we're not only just measuring the parent's engagement with their child. So I have daily routines with my child. I might say, yes, we're good at this. Now, the follow-up question here is the program helped me create daily routines with my child. The difference here is how are you doing with this? And then is the program supporting you with this area? So we may see a range of answers. We may have families refusing questions. Just I don't really know how to answer that, or I don't understand. But then also in terms of how they're responding, we may have a mom say, I'm not really good at this. I don't have daily routines yet. I'm working on it. And then they may say that the program is really helping me. I just haven't gotten it nailed. They may also say, yeah, we're good at this. We very much have our daily routines. The program didn't really help me do this. I just already knew how to do it. So you'll see that there may be differences. You may see that, yes, we've got good routines, and it was definitely because the program taught me how to do this. You'll see a range of answers here. So let's look at a couple other ones. I know how to help my child meet and play with other children. Following up here, the program has provided me with ideas about how to help my child meet and play with other children. I understand how to help my child manage his or her emotions. If I'm asking the guardian this question, again, I want to probably repeat the answer choices. So how much would you agree with this statement? I understand how to help my child manage his or her emotions. Would you say not at all, not very much, somewhat, mostly, or very much? I'll answer in one way or another. Okay, so following up on that, so it sounds like you know how to do this. That's great. How much would you say that the program contributed to how I help my child manage his or her emotions? Would you say not at all, not very much, somewhat, mostly, or very much? So again, you can repeat the answer choices as often as is needed, but probably after a number of questions, they'll remember and they'll say not at all or very much, right? Each of these sections contains an open-ended question at the end. So again, on the theme of building positive child-parent relationships here, we're going to say, okay, so now tell me more about how the program has affected how you and your child communicate. Again, there's a secondary prompt if we want to get a little bit more specific. So how has the program changed the way that you and your child talk and spend time together? And again, you can sit here and just take some notes. Or if we did an audio recording, we'll come back later and fill in some of those, maybe a direct quote, or again, just some of the highlights or things that we thought stood out in terms of areas that we could provide additional support. I'm going to click next. You'll see here we've got, I think it's 8 or 9 sections. It depends. There's a 9th section for the children who are aging out. But so you'll see, again, this pattern over and over again. I set aside time to read with my child. The program has encouraged me to set aside time to read with my child. Now, some questions like this, we've heard prompt additional comments, which you could just scroll down the page and start to actually take some notes down here. This reading one is one that we've heard from a family advocate who was talking with one of her families, and the family said, really not reading to our child. And they paused for a second and just sort of said, can I ask why? And they said, we don't have books at home. We don't have a library card. Well, right down here, I might jump down here and I might say, so we need books and a library card for this family. So again, opportunities for learning things that you can immediately act upon. But, you would continue with the conversation and say, okay, good to know. We'll get to, we'll find ways to help you with that. But let's continue. How much would you agree with this statement? I make sure my child and I have our weekly home visit. Of course, this is a question specific to home-based children that you wouldn't even see on the screen if you had indicated that child was center-based. Again, another open-ended question to round this out. So tell me more about how the program has affected your involvement in your child's education, etc. Now, as we keep going through these sections, you'll see we have, so Some of them are very basic, family growth and stability. We set goals or not. And then we've got our health and nutrition. So, receiving regular medical care. We're understanding emotional and mental well-being. And then the final two sections, I'll get there, are very general, open-ended questions. So what could the program do differently to better help you and your family? After asking them all of these specific questions, this is where they may have, their mind might have generated a lot of ideas and thoughts about what they want to tell you. So we give them this opportunity at the end. The final question here is just, is there anything else you would like me to know? Now I have the opportunity to mark this as complete. But again, we still have this button up here. I forgot to show all of you if I wanted to toggle between languages. So if I'm on this page and I'm speaking to a family in Spanish, I could go ahead and click Spanish. This is actually going to produce every single thing in this questionnaire in Spanish. So all of the prompts, all of the questions in the question response choices. Additionally, obviously the open-ended questions as well. So we can toggle between English, Spanish, French, and even Arabic. So this is really handy, when we have different language-speaking families. So that just about summarizes the interviews. One thing I did forget to point out that's really important is before you begin your interview, we really want to check on the details of both the child and the guardian to make sure that they're up to date. So before I talk with Mr. Phelps about James Nguyen, I'm going to look at James's record. And let's say that James was diagnosed with a disability in the middle of the year. I would definitely want to come in here and edit his details and indicate that he had a disability so I can make sure to ask the family about how they feel supported in that area. So before you start your interviews, always check their records for both the child and the guardian. Now, if for some reason you aren't finding them on your rosters, so I'm searching for the child and I can't find them, there's one of two situations. One might be that child was enrolled in a different center last year, so you'll want to contact your administrator to have them transfer the child to the center that you have access to. Or if you know that the child is brand new, you may need to create a record for them from scratch. But what we don't want to do is create duplicate records for children and guardians, because sometimes we want to track them over time. So if James was at a different center last year and I'm not seeing him on my roster here, I want to first check to make sure that he's not still on his old roster, because we want that one record of that child to have all of the interviews about him in one place. So now let's take a look at the reports. When you click on this tab here at the top, what you'll see are two options for either a baseline report or a growth report. A baseline report is essentially going to show you one snapshot in time of data from either a specific date range or one of your interview periods. Now, a few things about these report pages. Definitely the filters on the left are going to be very helpful for you to pinpoint the data that you're interested in and to sort of slice and dice it. So as I just mentioned, you can pick either just an evaluation period. If I want to look, for example, at my mid-year interviews, I happen to know this system has all the data from 17-18. I can, of course, like any of your other rosters, you can stack these filters. So I might want to look at just my early Head Start families data from the middle of the year between 2017 and maybe 2018. I could put in any number of these filters. And again, like you saw on the child roster, there are more filters than you can visibly see. So hover your mouse over and scroll down, and you'll see that you can pinpoint data just from, let's look at our families who have children with disabilities. How are they feeling about the support and resources? You can, of course, find just one center. I could even, as an interviewer, go in and just drill down into the data that I myself have collected. So I can select filter, and you'll see now I'm looking at, for example, 32 interviews. If I change any of these filters, let's say that I want to look at all of my interviews
that I've collected since 2017. Now I'm looking at 43 interviews. Maybe I'll even clear off the Head Start. Then I want to look at early Head Start and Head Start. Now I'm seeing 196. So these filters are very helpful in, again, just slicing and dicing down to exactly what you want to look at. Now, what you're going to see on this page are the mean scores from the closed-ended questions. You can take the answer choices from not at all to very much and essentially translate them into a scale of 1 to 5. And what you're seeing are the scores broken down into their mean or their average. And we've given you just a snapshot of the parent-focused questions versus the program-focused questions. But now you continue scrolling and you're going to see each and every question's mean score. So let's take a look. So when I started with the program, the staff tried to learn about my family's interests and concerns. You'll see a 3.89 is somewhere between somewhat and mostly. That's pretty good. Maybe we want to try to push the needle a little bit further next year and get us up into the 4 to 5 range. So we know that we maybe need to have something like a welcome packet or a meet and greet night. So you can make decisions based on the data that you're seeing here. So here we may see this is a pretty good score. The program has provided activities that help me get my child ready for school. We can keep looking, and what you're going to find are your strengths and your weaknesses. So for example, the program helps me understand how my child's disability affects their development. 2.77. 2.77 is only between not very much and somewhat. This is definitely something that we'd probably want to work on. Now, what's really cool is that you can also drill down into each question and see exactly how people responded. So we had 15 families saying, very much. We had 21 families saying not at all. So what I think one of the most powerful parts of this drill down is I can actually see exactly who responded to this question not at all. These are the families I'm probably going to want to really focus on in supporting them in this area. So I can click on this answer choice. And here I've got my families that are saying, I need more help. I don't understand how my child's disability affects their development. So we can really reach out to these folks and make sure that they've got the support that they need. So that is the baseline report, but one really important thing that I want to show you here is that you have this download Excel button. What this is going to do is just generate an Excel spreadsheet of the data. This is actually the data that's only shown with these specific filters. So if you did filter this down to say, I only want to see the interviews that I've conducted, you may have only, 20 interviews on that spreadsheet. But so you can see my computer downloaded a CSV file that's an Excel spreadsheet. And I already have one sort of pulled up here because I needed to zoom in to show you what it looks like. The text is pretty small. What you're going to see is a spreadsheet where each row represents one interview and with every single data point associated with that interview. So for example, what year was this? Which period of evaluation was this? Who was the guardian we spoke with? Which child are we talking about? Who's the interviewer, etc. Now, if you keep scrolling over to the right, what you're going to find are your raw data scores. So for question 1, we've got all of these response choices, and so on and so forth. And you keep scrolling, and this is where you can find the aggregate of all of your open-ended question responses. So this is a place where you can sort of look at everything all together. How are our families talking about these? Now, obviously, this is all fake data, but what I want to show you that's also very important is, okay, so what does OQ1 mean? And why am I seeing negative numbers in the closed-ended responses? There's a second tab on this spreadsheet called labels, and this actually translates everything for you. So column Q1, we've got the question here. OQ1, we now have the translation, so we know exactly, okay, let's get started. Tell me about your experiences so far, et cetera. And then the answer choices here are translated. So you may have been confused by seeing negative numbers. Those are just, either they refused, didn't know, they skipped, or they left it empty. So again, this actually just gives you the ability to really slice and dice your data however you want to. This is just, the complete set. But we do think that the filters already presented on the page are very helpful. So that's the baseline report. Now, looking at a growth report, what we can do is compare 2 points in time. So this is very helpful, for example, if you want to see your growth over this year. So I may say, you know what, I want to look at my 2000, again, going back in time, 2017-18 mid-year interviews versus my 2017-18 end-of-year interviews. I want to see, you know, I know that we learned things in the beginning and the middle of the year. We made some changes, and I want to see if those changes had an impact. So I pick my 2 rounds. And again, we have extensive filters here. I could, you know, just look at my families who have their children in the last year of the program. I can look at, you know, one teacher's classroom, and I would click filter. And the only difference here now that you'll see is that we've broken up not only the data into the average scores of parents versus program focus questions, but also, of course, we're comparing the 2 different points in time. So what you'll see for each and every question is the score that you got at the first evaluation period you selected compared to the score that you got on the second one. There are a few indicators. So for example, you'll see that there was some pretty significant growth here. So, you know, maybe this was an area that the program focused on, and they saw a significant positive change here. You may also, it's rare, but you could see a red down arrow, which means that the score has dropped, which means maybe you want to refocus a little bit more on that. And similarly to the baseline report, you can drill down into these questions and select, you know, the date range that you want to look at the answers, and you can see exactly who responded in which way. So the reports are just very helpful for you to learn about, you know, the trends across your program. But again, drilling down into each and every question, you learn more about which exact families need what support. The last thing within the site I want to point out really quickly is this Contact Us button at the top. So we have a form right here that is sent directly to tech support if you ever need any help. But also, we do have a direct email address here, pgtechsupport@nhsa.org. So that about wraps it up for our presentation today. I'll stay on the line for just a little bit in case any of you have questions. But otherwise, I just want to really thank you for everything that you're doing to support and engage your families. And, you know, we're here to help you make sure that ParentGauge is giving you everything you need to learn, you know, how your families are feeling and how your program is doing. Thank you very much.